This is Christina Fiore of MedPage Today, reporting from the Endocrine Society meeting in Boston. The Society has just released a new guideline on vitamin D deficiency. It's calling for screening of all at-risk populations, including the obese and African Americans. Earlier today, I spoke with Dr. Michael Hollick of Boston University, who is the chair of the guideline task force.
We don't recommend screening for the general population, but we recommend screening for children and adults who are at risk for vitamin D deficiency.
Which tests should be used for screening those patients?
We also recommend that the 25-hydroxy vitamin D assay be done by a reliable source, that don't ever order the active form of vitamin D. It tells you nothing about vitamin D status.
The levels are somewhat higher than those recently recommended by the Institute of Medicine.
The committee has recommended that to prevent and treat vitamin D deficiency, that children 0 to 1 year of age need at least 600 and up to 1,000 units of vitamin D a day. All children up to 19 years of age should be getting 1,000 units of vitamin D a day, and adults should be getting 1,500 to 2,000 units a day. There are certain groups that are at high risk for vitamin D deficiency, including African American men and women, as well as pregnant women, lactating women, patients with fat malabsorption syndromes, or have gastric bypass surgery, patients on anti-seizure medications, anti-AIDS medications.
Hollick says the difference is that the new guideline specifically targets deficiency.
The Institute of Medicine's goal was to recommend for the general populace, 97.5% of the population, regarding their bone health. The goal of our task force was to evaluate how to prevent and treat vitamin D deficiency. And so our recommendations are a lot different because we believe that a lot of children and adults in the United States are at high risk for vitamin D deficiency. We showed specifically the groups that are at high risk, and they're the ones that should be getting much higher levels of vitamin D to both prevent and treat vitamin D deficiency.
At the Endocrine Society meeting in Boston, I'm Christina Fiore, MedPage Today.